Oh, welcome to the JS Self Care Mind, Body, and Soul podcast. I am your host, Janell. This week we are discussing burnout with Stephanie from Simple Therapy. Before we begin, I have a question for you. Have you ever experienced burnout and felt as if you couldn't do it anymore? Well, without further ado, let us hear how Stephanie was at a point where she was burnt out and almost gave up, but didn't and kept going. Hello, Stephanie. Please introduce yourself and tell us about your experience with burnout.
Hi, Janelle, and thank you so much for having me. And yes, I am Stephanie Frietas. I am a licensed mental health counselor in New York, and I did experience burnout. So, really, for me, when I realized I was burnt out, I was at a point that I was so burnt out that I didn't realize how much I contributed to my burnout, right? So when I think about it, I really started burning out probably, in college. When I was in college doing my undergraduate, I was full-time student and I had two work study jobs and one job off campus. So I was very good in my time and I somehow got everything done and I achieved high academic marks. you know, it takes a lot of work and energy to be able to manage all of that. And when I graduated, I took a little bit of time off and I was working full time. And I decided I wanted to go back to school and I wanted to get my master's degree. And at that time, I had a supervisor at my job, and she said, Stephanie, when you go get your master's, get ready because you're going to sacrifice a lot. You're not going to have a lot of time to socialize. You're not going to sleep a lot, but it's going to be worth it in the end. And she was right. I did sacrifice a lot of my social life. I did sacrifice many hours of sleep. And when I was doing my master's, I was working full time. I was doing a full time academic load in my master's program.
Wow.
Mm-hmm. And then I had to do my internship. So with my internship, I wanted to get my internship hours within a certain time frame, right? Because you had to get certain prerequisite courses done prior to it, and then you had to get the hours done. So I wanted to get the hours done within a certain time frame. That meant I had to dedicate 20 to 30 hours a week to my internship, which meant I could not continue to work full time. However, I still have bills to pay and I still needed money to support myself. So what I did was I transitioned from working full time to working part time, 20 to 30 hours a week, doing my internship 20 to 30 hours a week, doing my full time academic course load, and then eventually got into the thesis. And
Wow.
yeah, so by the time I was doing the thesis, right, I was leaving my house 30 in the morning. I was getting home around 11:30 at night from whatever the case may be. And when I was on my days off, I was still driving into the city to do my thesis because I did a community-based survey. So I was doing so anyways, I would spend basically my entire days in the city when I was off also, right? When I technically had my resting time, I would be driving and doing my surveys and working on my thesis. And then I started, once I graduated with my master's, I was very blessed and I was able to start working full time immediately in a job with my, um, in a job in my field, very specialized, um, as a clinician.
Mm-hmm.
And, that's, I was very lucky because not everybody is able to like have their first job out of college, be in the field, right? And even as I'm talking now, I recall even too when I got my bachelor's, I was working at a psychiatric hospital for children and adolescents, and I was so motivated. I was actually doing 80-hour weeks there because I was doing doubles every other day at that hospital because I wanted to save up. I wanted things I wanted to buy. I had my own financial goals that I wanted to achieve. And so even then I was working pretty hard before I even went in to get my master's. And then by the time I was working full time, I decided, I wanted to be more than just a therapist. I wanted to be more than just a clinician. I ended up deciding I wanted to be a supervisor and I wanted to climb to the top of the ladder like so many people do, right?
True. Nobody wants to stay in one position.
Right. And in my mind, working myself and overworking myself was how I was going to prove to my boss that I was worthy of being promoted to the next level. And it did work. Could get promoted. I eventually did get promoted, but with those promotions came more responsibility. And because I was so motivated that I was focused on what can my bosses look at to say that Stephanie stands out. And I said numbers, right? Everyone understands numbers. So here I go. I'm going to carry a high caseload. I'm going to see as many patients as possible. I'm going to try to X amount of sessions per week. And I'm going to try to have my compliance rate be over X amount of time per week.
You were being an overachiever.
Exactly. So then what happened too was when I was getting burnt out, and it's really funny because I didn't notice it was happening until I noticed it was happening, right?
Mm-hmm.
So what happened was as I was trying to set boundaries and say, listen, I can't take on these extra assignments. I can't do this. I can't do that. First of all, it was hard for people to accept the because I always say yes. So I had to learn how to say no. Um, Part was I was just exhausted. I literally, even if I got things done, they were not being done in a way that I was used to performing or producing work, right? It was not coming out as high quality, we'll say. So, and I had to recognize that this was all associated with burnout because what was happening too was in my personal life, I was becoming short fused. I was becoming
Mm.
easily overwhelmed, irritable, basically everything that's the opposite of my personality traits.
You was like another person.
Basically, and my friends and my family were like, something is like wrong. Like I don't really think you see how you're kind of acting, your behavior is very different than what we're used to. And it wasn't until I really started having a network of clinicians that I started to realize, like, oh my goodness, I'm burnt out.
Out. Wow.
But by the time I realized I was burnt out, like the damage from the burnout had happened, right? I was exhausted to a point where I felt like no matter how much I rested, I just could not feel like I had rested. I was to a point that I was irritated with everything. Like I used to come home and I used to like not want to be bothered with people, not want to socialize. And I was perfectly fine, basically like not talking to anyone from the time I got home till the following morning.
Wow. So you
Yeah.
had no social self-care going on.
Yeah, basically, right. I really let my self-care go. Once I was able to recognize that it was burnout, I was able to say to myself, okay, I need to do something for myself. So I did start implementing certain things. So one thing that I used to do a lot of people do is I used to skip lunch.
Mm-hmm.
I don't skip lunch anymore. and ever. And whenever I
Wow.
start a new job, when it's my first day and I'm being trained, if it's like 12:30, 1 o'clock, and someone hasn't suggested taking a break, I will ask, like, I'm sorry, can you tell me what time lunch is? Because I do have to have a scheduled like lunch break every day. So is it okay like if we break now? Because I know that I need to like not skip lunch. Skipping lunch is
Wow.
not an option for me anymore. One
I
of the
have to
other
learn that. I'm
yeah, and I
learning it.
had to learn that.
And
One
it's
of the other
smart.
Yeah, one of the other things I had to learn too was I had to actively implement self-care, right? So
Mm-hmm.
when I lived at home with my parents, right, when I was like a student and everything like that, it was a lot easier because, I had my parents to kind of take care of what I call the adult responsibilities, right? So like laundry, right? Cooking, like the big bills because, I was living under their roof. So, money at the time was easy for me to save. Participating in self-care was easy because, you know, my parents were like, the girl is very hardworking. The girl is going to school. They didn't really bother me much at home because I was a good kid in that respect.
Right.
So it was very easy for me to be like, okay, I'm going to lay down, watch a movie, and not have to worry about anything else. When I transitioned to like living independently, that really changed for me, even though I have a partner who is incredibly helpful. He helps me out so much with cooking and cleaning, pretty much anything that I ask. I learned that I had to still kind of make time for it. It wasn't something that I could just kick back and do like I used to. And
Mm-hmm.
that was important for me to learn too. The other thing that I think that really stood, like I said, by the time I was burnt out, when I look back at it now, I feel like there was no way for me to be more burnt out than that ever in my entire life. you know?
So you
Um,
have committed yourself not to get into that point ever again.
exactly. And one of the things that was hard for me to accept was like I recognized it was burnout and I recognized I needed self-care, but it was difficult for me to accept that the self-care wasn't working as quickly as I wanted it to.
Mm.
Right? So I was, I'm into a lot of like crochet stuff. I really like to binge watch TV shows. I was doing all my coping skills and, all my self-care stuff. And I wasn't feeling better. And I was getting frustrated, and then some, and then, I realized I needed to have been doing my self-care much earlier on. And because of how burnt out I got, that meant I had to invest even that much more into my self-care, which was difficult because I was already just so tired from just being so burnt out.
Mm-hmm.
Yeah. So
Which
that
is
was
true.
difficult. But I managed, and I think ultimately what ended up working out for me was I ended up changing jobs a few years ago to something that was a little bit more predictable scheduling wise
Okay.
also, and that
Because at
really
that
helped.
point you were still doing hours.
Right.
Wow.
Yeah. So at that point I was still doing like community mental health, which that can, and I know you know this from experience, that sometimes can go into late evening hours.
Yes. And you don't
Yes.
stop.
Right. And I
And they will
recognize.
work you. The
Mhm.
the the bosses will work you and be like, can you do this? Can you do this? Can you do this? And if you don't set those boundaries with them, you will be working 90 hours.
And that's the thing too, because like I said, when I was at this agency, it's a very large agency. I wanted to stand out. So I was like, to do that, I have to be like the quote unquote perfect employee. But first of all, I don't think that that really exists because we as people are not perfect, right? But
So true.
But in my mind, doing extra work and working hard was what was going to pay off. And listen, it did pay off for me in a lot of ways. But one thing that I learned was I really had to manage how much I was working, because it was getting to a point that it was affecting my personality. It was creating problems
Mm.
with friends and families because they noticed I was irritated and
You were like a
short-fused.
grouch.
Yeah, exactly. And if you know me in my personal life, I'm very bubbly and I'm very upbeat. I'm not generally someone who's grumpy, right?
Mm-hmm.
And I learned that through that experience, and I learned that it's important for me to do my self-care every day, because one of the other things that was burning me out too, every job comes with its unique set of stressors, right? But as a clinician, as a therapist, right, we do talk about topics that most people, they don't talk about every day. Like, I talk
Absolutely.
about suicide almost daily. I
Mm-hmm.
talk about traumatic incidents, physical, sexual, emotional abuse almost daily. And I know I'm not alone in that, right? Every
Mm-hmm.
clinician, every social worker, and if you work in the mental health or a healthcare related field, these are things that are constantly coming up, right?
Yeah. Vicarious trauma every day, all day.
Right.
And if you see five clients, for those
Mhm.
that's listening, if you see five clients, all five of them have a different issue.
Absolutely. Absolutely. Right. And at the time, I was seeing 60 clients a week.
Whoa.
Right. So, and I was trying to help everyone, right? So there was also that piece too. Like, I wanted to save everybody. And the
Mm-hmm.
reality is we can only take people so far, right?
Yep.
And the other piece is too, is like you mentioned, like vicarious trauma. So we are talking about topics that really are upsetting at times to talk about, or difficult at times to talk about. So I also had to recognize that, because of the nature of the things that we talk about on the day to day of our jobs, because of the nature of those topics, I also have to be even more proactive in my self
Mm-hmm.
care, right?
Yep.
So that I'm not becoming depressed, and I'm
Mm-hmm.
able to function in my job also, because I need to be a source of support. And so that's how I really learned about self care, was, through having significant burnout, that, like, even today, I just have limitations, and I just don't do certain things, and I don't get upset if things don't get done by a certain time, unless, obviously within reason. But,
Right.
if I have laundry to do and I only get half the laundry done today and I have to finish the other half tomorrow, big
It's
deal.
okay.
Right.
Yep. It's
But if I have a
okay.
deadline to meet, of course I meet my deadline. But,
Right.
it's all about balance. And I think the hardest thing for me was, like, I was just so driven to climb the ladder, and I wanted to, like, be this strong, empowered businesswoman and this boss girl, like, in New York. And, nose dived into that, like, through work. And it kind of backfired because I wasn't taking care of my emotional health. And
Mm.
it's funny to say that, because I'm a clinician, right? This is what we do. We do emotional health. But it really took that experience and having a network of clinicians to really help me see, like, this is what burnout is. And it
Yeah.
actually helped me recognize it in my friends and family. I'm like, you're burnt out.
Mm-hmm.
And I know I'm not alone in burnout. It's not because I'm
No.
a therapist that I'm burnt out. You can be
No.
burnt out no matter what you do.
No, if you're a housewife, you're burnt out. If you're a house husband, you could get burnt out just
Right.
from keep washing the dishes. Like you said, it's a lot to do with work-life balance. I remember a time when Stephanie, I felt like I was at burnout. So when I used to work in New York City, I now work upstate, so the caseload is less. When I used to work in New York City, I would try to group the clients thinking that was self-care. So I would see all my sexual abuse clients on Monday. I would see all my substance abuse clients on Tuesday. I would try to categorize these 30 clients to avoid burnout. but not knowing that that was even harder on my brain and my
Right.
body.
Right.
Because when we're at burnout, physically, our body is affected. And a lot of people don't know that. That's where aches and pains. And we're like, my shoulder hurt. I didn't even hit my shoulder. That is tension that we're not releasing because people are pouring into us and we're not pouring out to anybody. We're keeping all that in. We're not only hearing what they're saying, we're also coming back to the office to now write a progress note as to what they told us. So once again, reliving what happened. So when I was at the space of burnout, I had to say to myself, Janelle, you need to go in there, speak to your supervisor, and tell her it's 31 days in a month, having 30 cases, and I was hired to do 20, and I know we short staff and stuff. I get it. I can't do those extra 10. It's wearing on my body. I'm at literally going home with body aches. And she was understanding, but if we don't speak up during burnout, the only thing is it keeps the fire going. It will keep it going until we're fried.
Absolutely, absolutely. And that was another thing that you mentioned too, that I didn't like, the amount of paperwork we have to do every time, right? We see a person. So I was seeing, at one point I was seeing anywhere between 8 patients to, maybe 12, maybe as high as 15, at one point, because where I worked, the sessions were half an hour, 30-minute sessions. So we were seeing a high volume of patients, and that was a lot of paperwork too. So that was also a part of what kept me in the office for so long. And with COVID, one of the things that I've learned is, with working from home, I'm able to take like meaningful breaks, right? So like it's so much easier for me to step out and go for a walk in the middle of the day versus when I was working in an office setting.
Mm-hmm.
Right.
And just to remember, everybody wants everything yesterday. I need this, I need this, I need that. And you don't have to be disrespectful, but you got to set those boundaries. And I'm so glad that you said lunch break. I am so horrible with lunch breaks. I will not leave the computer. Just recently, when I started school last week, I took a lunch break every day because I had reading to do. I had to say, you know what, I've done this for the job. I don't get paid for lunch. So at my job is whether you take lunch or you don't, you're not getting paid. It's up
Right.
to you on how you situate your time. And so most of the hours, those are volunteer hours. When I have a computer on and it's a lunch hour and I'm trying to barf down whatever food place I done passed, that would be McDonald's, Burger King, putting all that disgusting stuff in my body. That was my lunch break.
Right. Right. And that was like another thing too, right? That I learned too, like how I eat. Like when I was eating fried foods and stuff, I was a lot more tired going back from my lunch break versus when I ate fresh foods, right?
Mm-hmm.
But absolutely, because a lot of people will do that. We will eat, like, I tell people, maybe places where we don't have really like a break room. So yeah, you do kind of have to sit in your office, or you do have to sit at your desk, but at least don't work,
Yeah.
at least take the time to properly enjoy your meal,
Mm-hmm.
you know I do set that boundary for myself, because I know that when I start skipping lunch, and I start working late, I start staying later, and I start staying later. And so I had to learn that I had to have that self-care boundary, in place for me. I also don't carry super duper high caseloads like I used to before. I definitely have a cap, and I cap myself off at that.
Right.
Right.
Because you have control, because you have your own business. But
Right.
say someone who doesn't have control over how, say an office requires you to see 8 people, or if you the garbage man, you have to do the entire, let's say, Maybrook. How would you tell a person to cherish one their lunch break? Because we all get it. That is a state law.
Right.
How do how do we like promote it? Because some people just don't have control of their schedule. but also
Yeah.
don't get paid for the lunch break.
Right, right. So I mean, I feel like, if you're not getting, especially if you're not getting paid for your lunch break, you should definitely take your lunch break. It's as simple as saying, you can if you feel uncomfortable, I'll saying directly, "Hey, I haven't taken lunch in the past few days. I need to start taking my lunch again. I can't keep skipping lunch." You could always go with a, "Hey, can we schedule like lunch breaks so there's a rotating schedule for the day so everyone knows when everyone is out on lunch?"
That's a good idea.
Right? Or you can simply say, "Hey, I haven't eaten lunch. This is going to be my lunch break time from 1 to 1:30 or 1 to 2 p.m., whatever your job allows." And let your boss or your supervisor know that's when you'll be taking your lunch break every day. Like, pick a time and stick to it. Um and then if you do have to, shift it around here or there for meetings or an appointment, you can, but at least by saying, "Hey, I'm taking this hour or this 30 minutes for my lunch break," people know, okay, he or she is setting this boundary for themselves, or they're taking an hour a day for lunch.
Mm, that's some good advice. Is there anything that you could give us, Stephanie, to avoid burnout? Other than a lunch break, what else should we do for ourselves to avoid the feeling of burnout or to avoid just getting burnt out so fast?
Right. Yeah. So managing your workload as like much as possible. I know that sometimes like you said, it can be out of your control, but if there is a means for you to advocate for yourself to keep it manageable, definitely do that. For me, I know like scheduling was a big part of it for me because I was not so before I was working like an hour away from my house, and then traffic and everything. So I know for me, a part of it was like, even when I left work early or on time, I was still getting home super late because of rush hour and traffic. And I enjoy my evenings. So for me, one of the moves that I did was I chose a job that was closer to home,
Mm,
that would shorten my commute, and um that would allow me to have some evening time to myself. So that was a big thing for me, and that helped a lot. Like, I actually switched completely where I was working because I just didn't want that commute anymore.
right.
It got to a point that I was burnt out. I was doing all the self care, I was doing, and I'm so grateful for the experience because I met wonderful people. I learned so much, like professionally, in terms of like my clinical skills, but also, interpersonal skills and everything like that. I learned a lot. So I'm so grateful for every experience that I had. But it got to a point that I was just tired. So I said, what can I
Mm,
do to make myself less tired? I can work somewhere where it takes me 20 minutes to get home instead of an hour and a half.
that's a
So,
great idea.
so I made that move for myself. Um, but ultimately, I also knew I had this goal that I wanted to start my own practice.
So, what would you give to a stay at home parent? Even though house chores, everything needs to be done. Like one thing I say, I tell people, pick a space in your home. I don't care where it's at. Pick a space in your home and tell your family, when I'm in this space, I am only taking care of me. Unless you're bleeding or dying, do not disturb me. So, what will we say, like for people that's just home, working from home and just hustling and bustling, homeschooling the kids? I know it's summer, but all of those things that we were doing, like how would we implement self care, avoid burnout from being a stay at home parent? How would we help them with that?
So I think the best thing for anyone who like is, and I know it's difficult with COVID, right? But literally get outside. And I
Mm,
know that that can seem challenging. I know that people are like, well, there was a pandemic. I don't mean like go out to like the beaches or go to like a mountain and go on a hike, although if that is an option to you, I do encourage that. I just mean get outside. If you have a
there's
porch you
some
could
fresh
sit
air.
on, just step out of the house. It
Wow.
does wonders for your mental health to literally just step out of your house. If you're able to do something like take a walk as a family to like a local ice cream shop, that's a form of self-care because you're engaging in, positive memory making moments with your family, right? If you feel like you need the alone time, at step outside, you just go on your porch or stand outside on the sidewalk or your fire escape. Just have your head and your body be physically out of the house.
Mm-hmm. I
You don't
like
have to
that.
go far. Like if you're a single parent maybe and you can't child care or whatever, that's okay because you don't have to go far. Just like put a chair out there, listen to a little bit of music, watch some
Mm.
TikToks, do something to unplug your mind.
From all the house chores you have to do. So amazing that you said that, because I was sitting here like, pick a space, but that's even better going outside. When you go outside, fresh air clears the mind.
Right.
That's what they say. Fresh air clears the mind. And then you could always go back to it. But it's something else that you said that also resonated with me. If you don't get to finish something, the world is not going to end because you didn't finish your laundry.
Exactly.
Do enough laundry that way everybody have an outfit to wear for the next day and relax. Binge
Right.
watch TikToks. All of that stuff. Do something that make you laugh, dance, exercise, but don't get to the place where you can't take it no more.
Absolutely, right? Like the laundry's still gonna be there. The laundry, my friend has a joke. She goes, laundry's a never-ending cycle. And it's true. Like we wear clothes every day. So get done what is necessary and take time to enjoy time with your loved ones or even just time to yourself, you know?
Absolutely. So I want to thank you, Stephanie, for joining us today. But before we end, can you just tell us a little bit about Simple Therapy and how you help others, and what is the plan? What is your future goals for your business?
Yeah, absolutely. So we are a private practice. We provide outpatient mental health services. Typically, I work with adolescents, young adults, adults, and families. We talk a lot. I talk a lot about cultural issues, racial identity, uh, issues surrounding sexual identity, orientation, gender issues, life transitions, and college student mental health issues. So those are like
Mm.
a lot of our areas of focus, but we also do a lot of mood disorders like anxiety, depression, grief and loss. So we really are here for all your mental health needs. That's kind of the company's slogan, here for all your mental health needs. And we do individual therapy usually, but we also offer family therapy. We're located in Mamaroneck, New York. Right now, we're accepting Cigna and MVP. We are hopeful to get on more insurances, and we're offering telehealth and in-person appointments right now. So we are, working. We're basically, this is an inclusive practice. Everyone here is welcome. I want everyone to know that they have access somewhere to a therapist. And we're also really passionate about fighting stigma. So that's something that we speak out about a lot too, is fighting stigma towards people who have mental uh, or mental health concerns. And that's pretty much what our practice stands for. We want everyone to have access, and we want to reduce stigma.
How can we contact you if anyone listening to this podcast and would like to further the conversation? How would they contact you?
Absolutely. So we can be reached at 914-240-8550. Again, 914-240-8550. We also can be found at Simple Therapy Solutions, solutions with an S at the end.com. Or, of course, we can be found on Instagram. Our handle is simple therapy underscore.
Thank you so much for sharing your handles. For the last remark, can you give someone any advice from the conversation we had about burnout?
Absolutely. So when it comes to burnout, it's absolutely you to recognize the signs within yourself. So definitely make sure that you have boundaries, you respect your boundaries, you respect your limits, you do your self care, but you also check in with yourself and make sure that you are okay.
So I want to thank you for joining us, Stephanie. This was truly informative. And I learned a lot from burnout, even though I was at a place too, and most people are, but we always could learn something. So I want to thank you for joining the JS Self Care Mind, Body, and Soul podcast.
Thank you. Sorry, my voice just went. Thank you so much for having me. And I am so happy to be able to come speak on here. And I look forward to our live coming up also.
Yes, thank you.